Nicolas Quadio knows these red dirt roads like the back of his hand. He's a community mental health worker around Bouaké in central Ivory Coast.
I come twice a week. I try to make families aware that autism is a neurodevelopmental disorder.
Today, he brings his medical expertise to 7-year-old Divine. She presents symptoms of autism spectrum disorder.
As soon as she started walking, we noticed she was different.
The WHO estimates that 1% of the population in Ivory Coast could be affected, but this behavioural disorder remains poorly understood, especially in rural areas.
It's stigmatizing and it bothers me. People tell me she's disrespectful.
Here, autism often comes with prejudice against parents and children.
In Ivory Coast, it's frowned upon when you have a child that has a disorder. It brings shame to the family, and sometimes they want to keep them in the house and lock them up.
There's only one medical centre that takes care of autistic children in the region, and it's a 45-minute drive away. Divine's parents don't have the means to take her to see a specialist, so Nicolas makes the commute. Miss Kua is the director of the centre. She's one of the first speech therapists in Ivory Coast. She graduated in 2022. In the absence of a qualified doctor's diagnosis, she makes a first assessment with Divine. With only 5 child psychiatrists for more than 11 million children under the age of 14, the waiting list is long.
We have no funding. We don't have enough staff. Currently, we need a psychomotrician and a psychologist to help us take care of these children.
Ivorian health authorities plan to launch a vast autism screening project in 2023, but currently there's only one public care centre in the country and less than a dozen doctors trained in the management of autism.